Welcome to Healthcare Matters, the podcast where we explore key opportunities and challenges shaping the future of healthcare. Today we are discussing the pressing questions of whether creating a sustainable healthcare systems is a mission possible or not. Joining us is Professor Nick Guldemond, a global expert in healthcare system transformation and public health. Nick has worked extensively with organizations like the World Health Organization, and he is here today to share with us his insights about how to create a more resilient and sustainable healthcare systems. Welcome, Nick. It's great to have you here. Thank you so much for joining us today. And let me start by asking you, how are you today?
Thank you so much, Hassan, for this invitation, and it's really great pleasure to be here again. And I'm actually quite fine. And so I'm a person who's traveling a lot, but I'm also receiving a lot of energy from my visits and discussions. So I'm feeling pretty good also in the presence of you and our discussion.
Amazing. It's amazing to have you here in Sofia with us. And let me start with asking you, because you are leading and joining many innovative projects worldwide, and I wanted to know what sparked your interest to focus on healthcare system sustainability, and how even do you define the sustainability of the healthcare system?
Yes, thank you very much for this question. And actually, we have to go a little bit back. I think almost 25 years at my early start of the career. And I was at the time working in a cancer hospital in the Netherlands. And I supported research on brain tumors. And it's obviously a very devastating disease. Where I saw that many of the things we do in clinical practice from a medical point of view, where we try to help the people, was not sufficient. So we did research into the patient journey, and while the treatment like surgery, radiation, chemotherapy, we had all kind of options. We saw that throughout the journey, the sort of recovery and the quality of life was not always sufficient only by this sort of medical view. So that was the first experience as a young clinician to learn that not only, let's say, the medical intervention specifically are sufficient to create a better quality of care. And my career developed, and I moved a little bit also to different disease areas like diabetes, like fall prevention in elderly. And you saw time and time again similar sort of obstacles to improve care. And this is more this integrated, networked approach where you also should look at other aspects, not only the medical, but also the social aspects of prevention. So there was actually my sort of interest raised, and that also drove me to have a more broader perspective. How can we really improve, let's say, health of people? And then, it's almost obvious that you look at a more systems perspective, and where can we really improve? What are the typical obstacles? And you discover as well that there's a sort of commonalities in the sort of things, how systems work, also working internationally. So there is actually where my interest was triggered. And besides, let's say, the medical optimizations, we also, if we really want to benefit from a better system, we also have to look at other aspects as well.
Very true, and I liked very much how you established the link and even the bridges between the patient journey, how you nicely describe it, but at the same time how the healthcare system can really influence this journey positively. And that will take me to my next question. And based on your global experience, because our healthcare system faces globally different challenges, so what would be the key elements of a sustainable healthcare system?
Yes, I think you mentioned this sustainability, and I think although there are differences definitely, if you look into different healthcare systems, and Europe is a good example of a collection of different type of systems.
Very diverse.
And if you look more globally, different continents, obviously we have many differences there as well, especially from a cultural point of view. Although there are also a lot of commonalities. So if you look to basic elements, like, okay, is there a primary care infrastructure in place? Often that's a key element of, for example, for building sustainability. So is there proper access to secondary care, hospital care, specialized care? Is it affordable? Is there a proper, let's say, handover from more the hospital setting to home and recovery? Is there a social fabric who can take care of people? How are finances arranged in countries? So looking at these different aspects, if you look from a service perspective, primary, secondary, tertiary care, from a technology, is there technology available? Are there products like pharmaceuticals, diagnostics, quality of services? How is the healthcare managed? Is this only from an organizational perspective or more from a patient journey perspective? And like I mentioned, the financial and regulatory aspects. So these are the major building blocks. If you assess countries and a sort of system, there is a lot of commonalities in where are the challenges for countries. In our sort of perception of what is a resilient, sustainable healthcare system, there are some key cornerstones which you should have in order to make it sustainable. And the first one is to have a proper system for primary care. Because sustainability is partly depending on prevention. And prevention is not something which you only should do from an institutional hospital perspective. It's something you should do more on a community level. It should start at a very young age. There should be school, the local community, sports clubs might be involved. So that is something which is still quite challenging for most systems. So if you don't have a proper primary care and prevention in place, it's already problematic to create a sustainable system. That's what we see in some of the on some of the continents. And then, of course, you have hospital care, where there are some basic requirements for properly functioning system. There should also be technologies, etc., in place. And then, of course, is how the system is arranged with, sort of financing the system. Is there properly in place the sort of values, the principles, how the system is organized? So looking at this perspective, so you can see countries who do a little bit better, other who do a little bit worse. Mostly they have a lot in common, and there's not, let's say, one single example where it's really, let's say, all the things in place and where we really have the best practices. Therefore, we more have to look at regional, at the local settings. There we have typical examples where you have sustainable, let's say, microsystems where everything is properly arranged for the local context.
Very good. So prevention, as you mentioned, is really a very important starting point, and we usually hear this discussion. We call it Ministry of Health, but it focuses more on the disease and on the sickness. We need to come back, as you said, to the community, to the primary care, and the more we can strengthen this prevention strategy as a starting point, we can go more and more down this road for sustainability.
Exactly.
Yeah. So let's now maybe zoom in on Eastern Europe. So we talked about the global perspective, and you mentioned that there are different cultures, different healthcare systems, but I know that you have done a considerable work in Eastern Europe. So from your perspective, what are some of the key challenges and opportunities in Eastern Europe, and especially with relation to the sustainability of the healthcare systems?
Yes, thank you so much. And it's really a pleasure to work in this region. And so I've been to different countries and saw also the sort of local context. And usually when I work, I would like to see things and experience on how care is provided. So usually I travel in the country to urban areas or rural areas to understand how the healthcare system works for people. I think the region, most of the countries have a sort of post-Soviet history. And so they come from a sort of context where you had this sort of what's called the Shemaska system, which was actually in its origin quite similar to the NHS system, a single payer system, which was in the early days, the ideas very much focusing on prevention. And it might be surprised, but the NHS was actually inspired by, at the time, the socialistic model. Okay. So the post-war NHS was basically following the principles defined by Shemaska. Although the system, the whole Shemaska model, developed totally different. So it's not, let's say, it's different from the original idea. But if you look to the countries, so the countries are often in terms of institutional care quite fragmented. So if you come to, let's say, the locations where you see the older infrastructures, for example in Serbia, you see their sort of hospital campus where you see the neurology, the orthopedics, public health are all in different buildings. And yeah, also the primary care is not so much integrated in the system. So for a patient, it's often difficult to navigate in a sort of integrated approach where different disciplines are working together and where primary care is used as a sort of filter for filtering out, okay, is this really a complex problem or an easy to solve problem? And if so, yeah, can we just do it on a primary care level? Some recommendations, some prescription over-the-counter medicine, or this requires additional diagnostics process, maybe some more specialized care. So this sort of logistics and a sort of how the system is organized is often quite fragmented, as you also have in the more developed countries like the Netherlands. It's also not always very, let's say, smooth and integrated, but a hallmark of these Central Eastern European countries is often that they have this sort of fragmented infrastructure. Accordingly, also had a sort of experience with a multidisciplinary approach, follow the patients on its journey and anticipate on needs, is something which is still, there's still a lot of work to do. And because the system is more or less physically organized in that way, also the other elements like management, how it's financed, the sort of regulatory infrastructure is also pretty much in line with this more, let's say, fragmented approach. So typically, what we do when discussing in trying to optimize the system is that we try to start with the patient needs and how patient needs could be better met if we look to, let's say, existing infrastructure and how we could optimize it in terms of integration.
Okay.
So that's a typical approach we use in trying to start with thinking about health system optimization. Another element what is quite specific in the region is that often the political, let's say, change in governments is the turnover is quite high. That means also that sometimes the health policy planning over a longer time can be challenging because there's every 6 months or a year there might be a change of government, change of people, and maybe also in the authorities. So this makes also that the sort of policy planning and activities you have to take some extra measures. There are some countries who are quite stable, and look at the Netherlands. We are quite stable in sort of policies, but this might also be a sort of obstacle when you want to make changes in the system. So both the sort of high dynamics in a system from a policy planning point of view, you might have some challenge, but it might also in the other end of the spectrum in very stable systems. If you really want to make these changes happen, that you have to do really some new and radical things to really make the change happen. So there are some specific characteristics, but maybe last things in this context I want to mention. So there are the Western countries. As I said, they're quite stable. They usually over optimize, so usually there's not so much room to further optimize the process, and the change can be very challenging because the system's already so much organized with authorities with specific roles and responsibilities. So if you look to the Central Eastern European region, you could say in contrast there's still a lot of, let's say, opportunities and flexibilities. And this you can see also on a more local level, where there's a lot of opportunities to really do new things, to make relatively small investments to create a bigger impact. And this is also what I really like about the region. There's a sort of willingness, a sort of people are keen to make some improvements, and actually they might be quite feasible. Because the effort it would take, for example, in the UK or Germany and the Netherlands, it's enormous. But with the little effort you can do here, you can also create a bigger impact. So that describes, in general, I think also a bit the interest of the region to work here in healthcare.
I liked how you described our reality with really high level of accuracy. So definitely talking about the fragmentation that can hinder things like the multidisciplinary approach and things like the political volatility and continuous changes which can stop the policy work. On the other side, this opportunity to leapfrog. So we have seen even in countries like Bulgaria some things related to digital health in the past years and months. Because, as you said, the willingness is there. We are also starting, we can learn from the other experiences. So there is really a lot of willingness to really continue and compensate a bit. And that will take me to my next question, Nick, because usually your work intersect policy, technology, and practice. So my question, can you share an example where you have seen innovation, for example, or digital health helping really to add value to the sustainability of the healthcare system?
Yes, and that's, so the elements of how services work with people and the interaction between the professionals, how technology might enable them to make it better work. The governance, the management of the whole system, the finance regulation. So this points to the complexity. So if you want to make a change, you have to consider all these elements, and that makes healthcare transformation often so difficult. Because if you want to change a little thing, often you need something from all the other domains. And that makes also why innovation sometimes can be quite a tedious process. So we talked a little bit about a person-centered care, integration. So if you really look at the basics, so information sharing is one of the key elements to make people work together. So if you don't share information with each other in a very efficient, clear way, it's very difficult to collaborate with each other. Of course, you can phone each other, you can meet each other in rooms, but digitalization, if you look at the basics, information sharing, data accessibility is really key. So that's often where really if systems should start with improvement, with innovation, I should say this is a basic ingredient. If you look to our region, the Central Eastern European region, I think you see pockets where things are well organized, there's data available, maybe not from a full systems perspective, but in elements. So that's one thing. So we have in the region good examples. Also looking at, for example, Estonia, which in the Baltics, which is really, I think, an enlightening example of how you can digitalize healthcare, but also digitalize the total society. So that's a very good example. If you look to Croatia and Slovenia, they're also pretty good, well digitalized in terms of how to work with each other, from primary care, hospital care, patient summaries, e-prescription. I was recently, last year, we worked on the National Digital Health Strategy with WHO supporting Moldova. And Moldova is a system where they have pretty much similar elements like Estonia. So there's a good basic infrastructure. I wouldn't say that all healthcare organizations are sharing yet information, but the basics are pretty good. And so we worked there together with other countries, with Finland, with Norway, on Spain, on, okay, what can we learn from each other in digitalization and how to improve. And one of the topics was e-prescription. So we worked there from summer 23 to Christmas. And this year in May, they implemented e-prescription nationwide.
Ah, congratulations!
Yeah,
that's a big milestone. Yeah.
It's wonderful. So it shows how these countries just do something. If you would ask this in Germany, it will take a decade. I think the same as the Netherlands. So also we have a big problem with this. So it points to the sort of willingness, and like Romania, also working on a sort of national plan, also related to the national cancer plan. So it shows the sort of dynamics, and I think what's really interesting on how to do this with these countries. So technology definitely can use. So I told about the basics. So on top of that, of course, you have some other aspects which might improve quality of care. And that, for example, is that how can you use data to improve diagnostic procedures, to tailor therapies. So I think that's an add-on. So that definitely helps if you have databases and registry. It can learn on how to tailor specific interventions. So this definitely might help. It's also a good basis for innovation, for research, epidemiology. So that's besides, let's say, more the data exchange and data use in daily practice and management of care services, you have more this sort of advanced sort of data analytics and use for tailoring specific sort of interventions. And then you have more the systems perspective, where, okay, what can agencies and ministry learn from how institutions are performing, and how can you provide, let's say, a sort of monitoring and create incentives for providers in order to make the system really, let's say, quality outcome oriented, and that systems are aware of their performance, and accordingly also how can you can improve, and of course this can be shared with other countries. So I think if you look to technology, you should have a sort of leveled approach, where the basics, I think, is really a key thing. So it's nice to think about all these innovation elements. You should do it, but for the people, for the system, the basic information for A to B is, I think, the key priority. So that's when it comes to data and technology. And also, if you have the data available, you can also apply AI, for example, as an application of smart ICT. So if you don't have the data available, it doesn't make sense to really often talk really about AI solutions. Might be in pockets, radio diagnostics, radiographs, data. But really the gains for a sustainable system is more that you have the data available overall in the system, because that learns about system performance and how you can make it more efficient. And maybe a thing I didn't mention, but of course there are also ways how you can make better use of medical devices, maybe wearables in support of healthy living. So that also could help. So that's a way how technology can work, but it's not easy. So where technology can have, let's say, a real benefit, it's very subtle. It's not that every technology is per se good for the healthcare system. There are also a bad use for technology which can even make healthcare worse. So it's a subtle debate. It's not often, it's not easy to discuss this, also not with policymakers, and therefore we need this collaboration that we can share, let's say, the experiences and learn from each other what makes sense. I should say also medical technology providers should be aware of this, because it also helps them to make better use of their solutions and technologies. If you have a more, let's say, delicate, subtle debate about how you can best use technologies, you create the best efficiency, and accordingly you have also more investment available to invest in the right technologies.
A very interesting topic, and I know also that you are an expert member of the working group, WHO working group on digital health. Mm-hmm. So how do you envision the future? You mentioned the word technology multiple times, and you said definitely there are pros and cons, there are things that we need to watch out. But from this angle, how do you envision the future of healthcare if we really integrate the technology in?
Mm-hmm. Yes, also great question, and good to make this differentiation. So with WHO, so we look often from this service perspective. So if we want to improve service of people, like I said, we need to have the basics right, and that's you have to exchange data, information, if you want to work together, and accordingly you can work on person-centered integrated care. Then you have this sort of, there might be digital services, who makes the accessibility of healthcare much better for people, especially, for example, in rural areas. So then there might be some telemedicine services. We have this evidence and solutions, for example, for supporting diabetes, COPD, respiratory diseases. You can support people with cardiovascular risk management, with mental health issues, making, let's say, healthcare services better accessible and better affordable. So that's another layer where we can add. And it might be even also as a substitute for primary care. So if people consult, if they have a sort of problem, an app and maybe an online doctor, and the online doctor is filtering out the symptoms and see, okay, no, don't worry, just take a paracetamol, have some sleep, and we might talk later this week. You can also filter out a lot of the problems of people and really can pay attention for the more complex one. So we talk about sustainability. So a proper functioning primary care system for filtering out the simple from the complex cases is a hallmark of a sustainable system. Because also in terms of allocation of resources, it will be much more better if you really have the specialist working on the more complex cases and you don't want to work them on very simple issues. So that you can also create in a digital world. You should have it in the physical world with family doctors, with primary care centers, but you can also create it in a digital way. So that we have these basics, I thought, we have the specific services, diabetes, mental health, and then you have this sort of digital access from a sort of primary care perspective. And then we have more let's say the health systems, the sort of monitoring, epidemiological sort of application of data and technology, where you really would be able, if you have it accessible, to really manage a system better. Which also makes that you can work on the efficiency, on the performance of the system, but you can also apply it more to public health, at infection outbreaks, how to manage crises. Also, if you have more this sort of population view on the systems, you can also intervene more from a population level. So if you look to Sofia or Panakurice, it might be a totally different population. You might do different things in terms of allocating professionals, the infrastructure, be differently maybe to Sofia, I don't know, or Little Village. So that is the promise of data. This is often the sort of discussions we have with ministries. I think the key challenge for ministries and policies, how to translate these sort of concepts, what we know, into concrete implementation projects. How to start somewhere at a village in Bulgaria or in Sofia at a community area with sort of applying this principle, how to make the transition happening. That's, I think, the biggest challenge. So we know a lot about evidence, about practices. So I think we really need to do better in terms of implementation and making that a reality.
Indeed, implementation is a big challenge and big focus. As you said, we have many scenarios, we have a good concept, sometimes good strategy even, but then we struggle a bit with implementation. Like the example of the cancer plan, we were very excited about the beating cancer plan, but now we believe that more energy is needed in terms of implementation. Yeah, exactly. And that will take me to my last question. I think you mentioned already the concept of integrated care, and I believe this is central to your work. So how do you envision concepts like integrated care and integrated care services to really change the care and the healthcare systems in Europe, for example, some of the challenges, I believe you mentioned some of them, like the aging population is a big challenge we are facing in Europe, some of the chronic diseases we are facing. So what's your perspective on integrated care?
Yes, I think also the concept of integrated care is already there for a long time. I think almost for 4 decades we're talking about integrated care. So we know a lot about the principles and the concepts and how they might work, the evidence also for all these sort of models. Again, also here is the problem a little bit, the major problem is implementation. Integrated care, I think, is really closely related with value-based healthcare. So you almost could say they are interchangeable, although value-based healthcare is a little bit more looking at these sort of outcomes, and integrated care about more the process to generate those outcomes, but they are using more or less the same sort of concepts. So this is not easy, and to implement it top-down is really difficult. We also have these examples. So what we know is that usually it works better if we look, we start from more a local level where there's already energy and some maybe experience with different actors working together. Integrated care is about collaboration, focus on the patient needs. So typically you should involve a family doctor, a local community, social care worker, a specialist. So these are working as a sort of network, nurses, dietitian, etc. So this local context is usually a good place to start. It might also be a city, so it can, but you should have the people together, the relevant people together, to really discuss, okay, we have this ambition, how can we make this a reality? Where do we currently stand? Where are the hiccups? And already the process of discussing and how can we improve this? The process of discussing together is to learn from each other, to respect each other, to start a discussion, okay, maybe if you do this and I will delegate this to you, it might work, etc. So that sort of co-creation process at the local, regional level is a very important step towards implementation. So usually we look at, are there already, let's say, people who are working on this, on specific topics. So typically it might be on cardiovascular diseases or diabetes, where people are really working together, and that creates energy. It's very difficult to start, of course, with the most difficult cases and settings. So for example, if you take breast cancer care here in Bulgaria, in Panagurice, we have a wonderful colleague who's really doing wonderful work on this, have this holistic approach, including also prevention, mental health, recovery programs, and who's able to mobilize people, other professionals in the process. So these are typical the people at the network where you could say, okay, we already have some ingredients, we can see how we can further optimize, where maybe we could start a discussion with the authority on, okay, might be an opportunity, we do some things differently here, and accordingly, can we have some more flexibility in regulations, or can you support us with some finances? And a similar, so we talked about breast cancer, we have a good example in Romania, in Cluj-Napoca.
Yeah, okay.
Also a female oncologist who's wonderful in mobilizing people, really open person, not like a sort of macho style medicine, but a sort of engaging approach, really supporting her colleagues. It's a really inspiration for students. So so people matters. Also, if if there's some people, there's a hospital board or some other, let's say, regional authority who have some mandate and power to say, okay, this is really important for us. And this sort of engagement also of patients in the process is typically the areas where it could start. And there can be a lightning example of how it might work. And if they have the ability to reach out to their colleagues and say, hey, it's not about me, but we can work together. And they can also raise others on the platform. And that people really also feel appreciated, they see opportunities. And you are able to create this sort of positive movement. It might generate, you really can get traction and you can create scale and impact. So we have a good example in Wrocław in Poland. Okay. Also very nice, driven by a female oncologist. So we have in Bulgaria, in Poland and in Romania, we have these wonderful persons who are lightning examples. But it could, of course, could be male as well. So this is this bottom-up approach. Look, okay, where are the pockets where we could further start an upscaling? Meanwhile, we talk with authorities, with payers, we see these examples. How can we support them? And so we have examples from a policy perspective, what they can do, and start the discussion. Okay, do you see this opportunity? How can we help you? So we try also to organize intergovernmental collaborations and discussions to also empower policymakers. And often we also bring in the industry because you need the total, let's say, package in this, public and private. We can benefit from the private sector, the creativity or the power or the sort of more business lean focus on how to organize things. Accordingly, so you should look from different angles on how to support this process. The key should be the operational process of improving care with the different actors. There's where the energy should go to. Then, of course, you have the supporting, let's say, agencies, organizations, including the private sector. And then you have the policy level. So it's really the energy, it should start at the local level and we should support them. We should equip them also with the knowledge and expertise. But then you come to the different other levels. So it's a multi-level approach. If you only do it from bottom up or from top down, it won't work. So it needs a total system approach. Again, it's not easy, but yeah, we can work in this. And I think in Europe we have this unique infrastructure, which is really a benefit for Europe. So that's, I think, yeah, it's a long story, but yeah, it's sort of in a nutshell about the sort of work I'm doing, from commuting between different levels and different dimensions. But yeah, that makes it also a lot of fun.
Yeah, exactly. It's a lot of fun and great to see that leadership is very important. Hearing you describing how leadership and how those great leaders with some inspiring examples made the system possible and made the concept of integrated care possible. Really kudos to those leaders, and I think we need more and more in the healthcare sector for sure. Now, as we are reaching close to the closing of the episode, any final reflection from your side, Nick?
Well, I think we are in an interesting moment of time, and we facing a sort of difficult context, geopolitical, which not make it always easy. In some countries you see economic contraction, but especially in the Central Eastern European region, actually some countries are really doing well. Romania, Poland are really moving ahead, which creates opportunities, but in general we're facing a challenging world. What I think the good message is that we share the challenges. As I said, in Europe at least, we have a very good infrastructure to rapidly change, learn and work together. I think we should do. We should strengthen these networks. I think politically it's not always easy, but from an industry perspective, the bigger and the smaller do see the opportunities. We have to work together, we have to make this work. It will also be good for economies and businesses, and accordingly also we can maintain the investments for healthcare. So it's interesting because we have the challenges but also the opportunities, and we should realize together.
Thank you so much for the insightful discussion and for the valuable reflections. I had a lot of learning, and you triggered a lot of thoughts. Indeed, we have to work together and we have to make it happen. There is a strong links between the patient journey and also the healthcare systems. Indeed, we can start working by prevention. There are other enablers like technology and digital healthcare. Even some of the existing concepts like integrated care has existed for more than 4 decades, but it can add a lot of value to the system. It takes a lot of leadership, a lot of collaboration, but this collaboration and leadership will make the concept of resilient and sustainable healthcare system possible, because healthcare matters.